Hello everyone. So let's have a look at some CVS and respiratory questions. Bainbridge reflex causes which of the following? Now what is this Bainbridge reflex? Now whenever there is a sudden increase in blood volume, this now causes an increase in heart rate. So that means a Bainbridge reflex results in an increased heart rate. Now, let's try and correlate this clinically. Sometimes when you're giving blood transfusion to a patient, this patient starts complaining of palpitations. There is an increase in his heart rate. Yes? And what is your immediate response? You decrease the rate at which the blood is flowing. So this is the Bainbridge reflex. Now, which are the receptors which are responsible for this reflex? Whenever there is an increase in blood volume, it will stimulate the atrial stretch receptors. What are these atrial stretch receptors? These are volume receptors. They are present in low pressure zones, such as the atria and the pulmonary vessels. Now, these atrial stretch receptors, they inhibit the vagal action on the SA node. And once they do that, what is going to be the effect on the heart rate? It increases the heart rate. So the response is an increased heart rate. Next, first heart sound coincides with which of the following? Now, if you remember the LV pressure volume loop, we have discussed this earlier as well. This is what an LV pressure volume loop looks like. This is point A, point B, point C, point D. Now, A is onset of ventricular systole. This is the point where the mitral valve closes, and this is the first heart sound. After this, A to B is the isovolumetric contraction phase. At point B, the aortic valve opens. From B to C is the phase of ejection. At the end of the ejection phase, at point C, the aortic valve closes, giving rise to the second heart sound. From C to D is the isovolumetric relaxation phase, and at the end of this phase, that means at point D, the mitral valve opens and now starts the filling phase. D to A is the filling phase. A to B, isovolumetric contraction. B to C, ejection phase. C to D, isovolumetric relaxation. And D to A is the filling phase. Between S1 and S2, between points A and C is systole, between C and A is diastole. So first heart sound coincides with which of the following? Onset of the ejection phase? No. What is coinciding with onset of ejection phase? Point B, opening of the aortic valve. Onset of isovolumetric contraction phase? Yes. This is the onset of systole, and the first phase of systole is isovolumetric contraction. Let's look at the next question. A 25-year-old man hiking in Leh experiences increased rate and depth of ventilation. Which of the following is a probable cause of high altitude hypoxia? High barometric pressure at high altitude? Definitely not. At high altitude, the barometric pressure decreases. The air becomes rarefied, and the barometric pressure or the atmospheric pressure reduces. Is there a decreased percentage of oxygen in the atmosphere? No. The percentage of oxygen, which is approximately 21%, remains constant. It is 21% of oxygen in the atmosphere, whether you're in Delhi, Bangalore, Chennai, or in Leh Ladakh. It will be the same. But what is going to decrease is the partial pressure of oxygen in the atmosphere, which results in a high altitude hypoxia. High partial pressure of CO2 in the atmosphere? Definitely not. Please remember, how do we calculate the partial pressure of oxygen in the atmosphere? This is the fractional concentration of oxygen into the barometric pressure. So if you are at sea level, the partial pressure of oxygen will be 21 upon 100 into 760. The atmospheric pressure at sea level is 760 millimeters of mercury. If you go to high altitude, this atmospheric pressure will reduce, therefore the partial pressure of oxygen will decrease. Let's have a look at the next question. A large V wave on JVP is seen in which of the following conditions? A wave is atrial contraction. C wave is due to bulging of the closed tricuspid valve into the right atrium during isovolumetric contraction. This is followed by a negative wave, which is the X descent because of a downward pull of the closed tricuspid valve into the right ventricle during the ejection phase. Then there is a V wave, which is due to passive filling of the atrium or venous filling of the right atrium just before opening of the tricuspid valve, and once the tricuspid valve opens, you get another negative wave, which is the Y descent. So A, C, V are the positive waves, X and descent and Y descent are the negative waves. Now, when will I get a large V wave? A large V wave will be seen when the V wave we said is due to filling of the right atrium, venous filling of the right atrium just before opening of the tricuspid valve. Now, supposing there is a tricuspid regurgitation, blood will not only come from the superior and the inferior vena cavas, but also regurgitate from the right ventricle into the right atrium. So now there will be a larger V wave. So tricuspid regurgitation is going to be my answer. Now, aortic stenosis and aortic regurgitation is not going to affect the JVP. JVP is affected by changes on the right side. Tricuspid stenosis, if there is a tricuspid stenosis, I will get a large A wave because now the atrium has to exert more pressure to open a stenosed tricuspid valve. So in tricuspid regurgitation, a large V wave. Let's look at this question. A 35-year-old comatose woman with a history of depression attempted suicide by locking herself in a car with the ignition on and exhaust connected with a pipe to the cabin of the car. This is a typical case of carbon monoxide poisoning. The oxygen hemoglobin dissociation curve in her condition is which of the following? Normal curve is in blue and the abnormal is in red. Now please understand what happens in carbon monoxide poisoning. Now we know that each hemoglobin has got 4 heme. Now whenever there is carbon monoxide in the inspired air, the affinity of carbon monoxide and heme is 210 times the affinity of oxygen and heme. So what will happen is carbon monoxide will go and bind with that heme. And this union between carbon monoxide and heme is a very tight union. Carbon monoxide cannot be displaced. So that means the heme which is available to bind with oxygen reduces. That means there is a decrease in the saturation. So when you look at the oxygen hemoglobin dissociation curve, you have PO2 on the x-axis and saturation on the y-axis. So in carbon monoxide poisoning, I expect the curve to be lower, decreased saturation, as for example, you can see in curve A, as well as in curve C, decreased saturation. Curves B and D, the saturation is normal. So that's not possible. Remember, it is saturation with oxygen. That will be reduced in carbon monoxide poisoning. Now, is the answer going to be A or C? Now, please see, in what happens is, carbon monoxide decreases the glycolysis, inhibits the glycolysis, and decreases to 3-BPG. And if there is a decrease in 2,3-BPG, this shifts the curve to the left. So the oxygen hemoglobin dissociation curve will be shifted to the left. So my answer is going to be C. See, carbon monoxide poisoning is not only decreasing the saturation of hemoglobin with oxygen, but whatever oxygen is present will also be tightly bound. Remember, left shift means more affinity of the hemoglobin for oxygen. So the oxygen hemoglobin dissociation curve is shifted to the left. So my answer becomes C. That is why carbon monoxide poisoning is so dangerous.